that you have gotten. And we would be very grateful if you will fill these out and drop them off. There is a box out there, right? Drop them off before you leave. The other thing is that we're launching the brain health survey, and Isabelle will soon tell more about that. But we also want to give a reminder on that. You have a little card there on that. So with that being said, it is now my great pleasure to introduce Isabelle Budin-Ljøsne, who is in charge of the stakeholder engagement work package in Lifebrain. She works at the National Institute of Public Health in Norway as a bioethicist and also as a senior advisor. And she has done immense work in Lifebrain on this. And she has really gotten a lot of people engaged, including me. So welcome, Isabelle. Thank you.
Thank you. And thank you for being so courageous to stay after a very long day. Today we've heard a lot about research being conducted to understand what promotes brain health and what is problematic for brain health. But one thing we really need to know is, do we have people on board? And this is something that we have been trying to do to understand in Lifebrain. So I'm going to tell you about two studies that are conducted by Lifebrain. The one is a qualitative study that is finished, so I'll present you some of the results very quickly. And the other study is ongoing, and I'm going to encourage you to help us promote this study. So our first study was a qualitative interview study that we conducted last year. We interviewed individuals participating in Lifebrain cohorts at 4 research sites in Oslo, Berlin, Barcelona, and Oxford. And basically, we wanted to understand their perceptions of brain health. So we asked them about how they understood brain health. We wanted to know about their interest in maintaining a good brain, a healthy brain. We wanted to know whether they were doing anything in particular to take care of their brain, whether they would be willing to know more and would be willing to take tests, for instance, to know more about their brain health. And we also wanted to know about their intentions to maintain a good brain health. So basically, apply the research that you are doing in their everyday life. So this was our sample, gender balanced, primarily middle-aged to seniors, and quite well educated. We had also a number of retired people. And when we ask our participants to describe what is a person with a healthy brain, there is this sense of normality. So this is someone that functions normally in everyday life, who is in balance, who is active, has ability to cope with own feelings, or is happy. So, but most of the descriptions that were made referred to cognitive health rather than mental health. And many references were made to memory, that this is someone that remembers well. And some of our participants also acknowledged that it is fully possible to have a brilliant mind in a dysfunctional body. And Stephen Hawkins was a typical example that was referred to. A key finding was also that when we asked people about their brain health, they basically said that, I don't really think about it. And this was kind of surprising because we were interviewing people participating in brain research, so we were expecting that they would be interested in brain health. And they just more or less confessed that this is not something I think about. And one of our participants really put it into words and said, most people, if they have a healthy brain, they don't think about their brain. And they also acknowledge that it's actually easier to think about your brain if you have an experience of brain disease, either yourself or in your family, but otherwise most people don't really think about it. And they also felt that they were quite in control of their brain health. We saw that, interestingly, people understand that, they understand that the brain is part of the body, obviously. They were quite aware of risk and protective factors for brain health. So the list that was mentioned earlier this morning, from the WHO, all the things that are good for the brain. People seem to know about it, although they don't know the details. But still, they do not specifically think about their brain health. So their focus is more on their general health and well-being. And those few of our participants who thought about their brain usually picked a very specific strategy, like taking supplements or having a specific diet or doing memory games or stuff like that. Most of our participants were interested in undergoing a test to learn about their brain health. We were not specific about the test, but most of them were very interested. So they wanted to know about both their brain health status at the moment and their potential risk of developing a brain disease in the future. This applied to preventable diseases. It was a bit more mitigated when it came to non-preventable diseases, but still there was great interest in knowing about this. But there were a number of conditions they were putting to knowing about their health status, brain health status, and doing some lifestyle changes or doing anything for their brain. First of all, scientific evidence. So that's what you guys are doing. They want the scientific evidence that doing something for your brain has an impact. They wanted to do things that fit in their daily life. So that was really, the key element. They said, I would probably be willing to do some changes, but if it doesn't fit me, I know I would be motivated. So motivation and, the everyday life aspect is really important. And they were also in demand of personal follow-up, which is challenging for healthcare systems, knowing that we have limited resources. We also asked them about their views on brain health promotion. According to you, what should be done to improve brain health in populations? And again, the message was very clear. We need concise, practical, reliable, consistent information about what is important for brain health and something that is tailored to our needs. So a reference was made to information you can find in the media today, when the one day you are told that you should eat eggs, the day after you shouldn't. So this really creates uncertainty for people. They were also quite interested in mechanisms that I call carrot and stick policies, where you use measures like subsidies or taxes to promote healthy behaviors. And a typical example was rewarding physical activity or encouraging physical activity. So this study is now finalized and was just published last night, so it's all brand new, right from the oven. And after, so we had this study on a very limited sample of people, but now next step is to learn more about people's perceptions on brain health, but on a much larger sample. That's why we launched the Global Brain Health Survey just before the summer. We are basically asking the same questions as we did during our interview studies. But this is online, this is anonymous, it's open to anyone above 18 years of age. It takes approximately 15 minutes to complete if you really want to do this well. And it's currently available in 12 languages. We're going to expand to Chinese and Hebrew in the coming weeks. So this is getting bigger and bigger. So again, we're asking about perceptions of brain health, interest in maintaining good health, and what people are willing to do to maintain their brain health. So this study is done in collaboration with national brain councils in Germany, Norway, and Belgium, and the National University of Oslo Academy in Ukraine. So we launched the study at a public lecture in Oslo on June 4th, and we already have more than 4,007 answers from many different countries. Spain is leading, followed by Norway, and Germany is third. So just to encourage you. And the survey will be open until August 2020. So after that, of course, we'll make the results available publicly. We'll share them with the National Brain Councils, and we hope that this can give some practical guidance regarding what needs to be done. So I'm not going to tell you anything about the results we have right now, because we had a little look at the results that we have so far, and it seems to coincide quite well with what our research participants in the Lifebrain cohorts told us. So apparently there's a need for more information, and there's a need for personal follow-up and really concise guidelines regarding what to do. You have all received a little postcard with information about the survey. It's available on the Lifebrain website. We also just published it on the Lifebrain Facebook, and I think it's also on Twitter. So just share it, take the survey yourself, and hopefully we'll get a lot of responses that give us some good and consistent data that we can use so that we can inform you in your research regarding what you need to do. Thank you.
Thank you very much for a great talk. So I think we have some questions. Gael.
Thank you. Thank you very much. So I understand it's still ongoing, but I was wondering whether you are interested and maybe you start looking at whether you have differences in the perception across countries.
Yeah, so we didn't do that in the interview study because our sample was so small. And looking at the data, we couldn't find any differences. And this was a bit surprising too, because we were expecting maybe cultural differences at least. But the intention is to have a look at it if we see that there's a pattern in the data, yes. Mm.
Questions? Yes?
Hi, yes, I just wanted to ask about how you're publicising the survey. How are you engaging with people in all these different countries? Just wanted to hear a bit more about how you're contacting them and engaging with them.
Yeah, so we're using different channels. So we've been using the channels of the partners participating in Lifebrain. We've been using the channels of the national brain councils that we collaborate with. We are using a lot of online tools that are available. We try to organize public lectures to inform about it. We use basically all of our contacts. And I'm a bit aware that there's a weakness in this because our contacts are people very, very much like us. So I think we need in the coming months to come up with strategies for reaching out to people that are quite different from or live in different environments that we do. I can tell you, but it's just between us, that the respondents to the survey so far are mostly middle-aged women with high education, the typical sample, which is a bit unsatisfactory because we want to have other groups represented.
Yes, so we hope that you can help us with that and
Yes.
encourage people who are not middle-aged women with high education to take this survey, especially. So that should be possible. Okay, thank you very much, Isabelle, again, for a great talk. So now it is my great pleasure to introduce Alfons Schnitzler, who is president of the German Brain Council and also from the Heinrich Heine University Düsseldorf, and where he is professor and chairman of the Institute for Clinical Neuroscience